what became very clear with Senator Jackson's questions is that she thinks that there should be more parental consent required, including for situations like she's bringing up now, that like we all knew that she was going to be like bitching about abortion, right? Like, even though like under the current law,
nobody can get
abortion is banned. That's right. Like, a parent can't consent to a goddamn abortion. Like, that's just like that's the law. Like, that there's nothing about this bill that needs to address whether a parent can consent to an abortion, because they can't. It's illegal to have an abortion unless it falls into our extremely narrow, extremely vague exceptions. But then, now we start going into like alcohol treatment, like, alcohol and drug abuse treatment, where like already in the law, there are exceptions that teens can, that
also with
can consent.
STI treatment. Yeah.
Yes. And she's like, wait, that sounds fucked up. Like, kids shouldn't be able to consent to that sort of treatment without parental consent, which not only is current law, but also is like obviously needs to be the case.
Welcome to Seriously, the podcast that dives into the baffling.
We can't send them to a prison where there's animals, where there's livestock.
The ridiculous.
Like omelets better than sex.
And downright unbelievable political climate in red states like Louisiana.
So we can't go there. There's no vegan jail.
Seriously.
In this bonus episode of Seriously, we continue our conversation with Morgan Lamandre, an attorney at STAR, an organization that fights for the rights and the well-being of sexual assault survivors. We covered a lot in that conversation that we had with Morgan a couple weeks ago, because there were too many absolutely fucking insane things that went down during this year's legislative session in Louisiana for us to fit into one episode. So we're going to talk a little bit more with Morgan in this episode. And then later, I'm going to talk about another bill that we didn't get into before. But here's a little more from our chat with Morgan. There was a hearing in the Senate Health and Welfare Committee on House Bill 400. We talked about this bill at the very beginning of the session. We haven't really talked about it since then. So this is the bill that would require parental consent for non-emergency medical care. And as it made its way through the process, there were like amendments, all kinds of exceptions, but it's still a real fucked up bill. And the way that they amended it, we're just literally making shit up. Like, they were adding in all of these exceptions that conflicted with other parts of the law.
And I mean, I've already given like Rep. Chenevert some credit for being willing to like work with people on the bill. But the problem is that like the bill itself is just fucking problematic. Like, there's just no real way to amend what they're trying to do in a way that isn't going to be problematic. Because the only way to actually do that would be to reconceive the bill as like one that just creates exceptions to when parental consent would be needed, as opposed to creating a broad exemption for parental consent that has limited exceptions.
Yeah, it's really ridiculous. I think the thing that surprised many of us that were in the committee and watching the bill was when the bill came up, Senator Katrina Jackson Andrews, who we have talked about on the podcast as being one of the darlings of the Louisiana Right to Life and is responsible for the trigger ban and also the constitutional amendment. So she's on the committee, and we're going to play a little bit of her raising her concern, and then we can talk about it.
And when you go down to the exceptions that a minor can consent to medical and mental health services, if the minor is pregnant and consenting to medical or surgical care or services related to the pregnancy, that's very, very concerning to me. I think a parent has the right to know if their child is pregnant. I liken it, and I've always kind of been very cautionary of this with human trafficking, or when a step parent has, or a boyfriend has, molested, for lack of a better word. That's what it is. Well, and I don't understand how pregnancy of a minor makes that minor of a mental capacity to consent to treatment without her mother.
That is current law right now, so that's not changing.
We're basically emancipating, almost for medical purposes, treatment in this legislation. We're emancipating a girl who's pregnant for her medical treatment, and that's very concerning.
So yeah, so this hearing went off the fucking rails. Like it went off the rails on this bill, because there were people who testified that like the bill did not go far enough. And then there were, of course, people testifying or asking questions that were like, oh, wait, no, the bill goes too far. And what became very clear with Senator Jackson's questions is that she thinks that there should be more parental consent required. We all knew that she was going to be like bitching about abortion, right? Like, even though under the current law,
Nobody
because
can get a
abortion
fucking
is
abortion.
banned. That's right. Like a parent can't consent to a goddamn abortion. Like that's the law. Like that there's nothing about this bill that needs to address whether a parent can consent to an abortion because they can't.
Is this current law D if the minor is seeking treatment for alcohol or substance abuse?
Yes, ma'am. There is 40:1079.2 is treatment for drug abuse.
And,
Yes,
and
ma'am.
it's already on the book for sexually transmitted diseases?
Yes, ma'am. That is also in 40:1121.8. That's the minor's consent for treatment of venereal diseases.
So we allow Louisiana minor to make all of these healthcare decisions.
And yeah, now we start going into like alcohol treatment, like, alcohol and drug abuse treatment, where already in the law, there are exceptions that teens can consent.
STI treatment. Yeah.
Yes. And she's like, wait, that sounds fucked up. Like kids shouldn't be able to consent to that sort of treatment without parental consent, which not only is current law, but also is like obviously needs to be the case, because not everybody has a legal guardian at all. Certainly not everybody has a supportive legal guardian or parent. Young people need to be able to access this kind of care without parental consent. And she's basically like,
Wait,
well,
what?
that seems
Wait, this is
fucked up.
already in the law? Like, what,
It said it in, what she was looking at, like it literally says on there, repeals these other sections. You have to read the law, not the digest. Also, you have to go and reference the statutes as they currently are. Like, read the bill.
And when misguided lawmakers want to revisit these issues, all kinds of nutballs like Katrina Jackson are going to be like, oh, wait, why are kids allowed to consent to treatment for alcohol or substance abuse without their parents' consent? Like the number of people in our state and in all states who are dealing with substance abuse, who have addicted parents, like, yeah, no, those kids need to be able to get treatment themselves.
Also, more likely than not, if the kids are addicted and they've identified that they need treatment, again, it goes back to one of those things where the parents are not there. The parents are either dead, there hasn't been any kind of formal custody type issue, incarcerated. So it's not that, again, it's not parents that just are not being informed. It's people who are not there. And I think that they keep framing these issues as if all parents are great, all parents are going to be supportive of their children and do the things. The people who are complaining about these issues, I don't think that they're let out the door. I don't think they go to public or private schools. I think that they're homeschooled. I think that there is very little exposure to those children, which also I have concerns about at times, because if you're constantly, restricting access to the outside world, you can't get help if you are being abused.
Yeah. Absolutely. And this comes up like then there's talk about like
trafficking,
always going back to trafficking, right? Which again is a serious issue, but then their framing of how this will play out is like, I'm like, that's exactly the opposite. If you're a parent who is involved in trafficking your children, which 100% happens, we need to be clear about that. That 100% happens. Yeah. So if you're a parent that's involved in that, then requiring parental consent to care for a pregnant,
they'll actually decline it because it proves. That was what drove me so crazy. I think on the House side, there was a line of questioning that Mandy Landry was trying to get at. And it was not, people don't even understand these situations. If somebody shows up to a hospital, an emergency situation, most normal people, if you're like, oh, an emergency situation, they're brought to the emergency room, they perceive that to be somebody's bleeding. Of course, if you're bleeding out because you're, postpartum hemorrhage, that may not be an emergency. I don't know about that.
Well, I mean, you at least need to do a pregnancy test first.
Well, absolutely. You need to at least do a pregnancy test. But most people perceive that. But if you present, you just don't look outwardly like you have any injuries. And you're asked right away, where's your parent? And it doesn't even allow the conversation behind closed doors to happen. That is where the issue is. But most sexual assault survivors who are 13, 14, if they show up, they don't want to disclose anything, and that prevents them from even being brought in a space to have a conversation. That's the issue. And then if you're saying, we need to get parental consent for this forensic medical exam, and the person just said, my mom's boyfriend raped me, and mom is saying, this is not, I don't consent to this. And that's what you need to not only get treatment, but to get forensic evidence to prosecute. Come on. Why are you saying you need parental consent? Mm-hmm. And I think that people are losing sight of what this is really about. It boils down to these political issues, gender affirming care, abortion, and then vaccines. So if that's the case, then just say that.
As a parent myself, I honestly question this whole concern, because I truly believe that I have the kind of relationship with my daughter that she would feel comfortable coming to me and talking to me about anything that was going on. Mm-hmm. If she was dealing with substance abuse issues, if she had been sexually assaulted or even harassed, if she had become pregnant, if she needed birth control, I am confident enough in my skills as a fucking parent that we have that relationship. What is wrong with these people? This is my fundamental question. What is wrong with these people that they don't trust the relationship that they have with their children, that they think that their children are going to go off? That's what they need to be interrogating, to be honest with you.
We know the answer to this. The truth is, if their kids come to them and say anything that is remotely perceived to be not even controversial against their religion, this is a sin, don't do it. This is a sin, don't do it. They could be asking just about changes to their body and they're made to ignore it, or it's down there. I think that those of us in this field who are very open and talk to our kids, we use proper terminology. Right. Of course they're going to feel comfortable coming to us. But I also know, as a mom who has a 12-year-old boy now, that he is experiencing changes, that he'll try to talk to me and I could see him getting embarrassed, and it's, do you want to talk to your doctor? I want you to be comfortable. And then he comes back and he may talk to me even more, but I also trust the professionals I'm bringing my kid to. You want
him to have a doctor that he can go to without having that doctor have to call you and get you to give written permission.
Records. I don't believe I have a right to his records.
No.
In that way. I think that if I ever needed something in those records to further facilitate treatment in some way, then the doctor is going to tell me.
And it's absolutely best practices.
Absolutely.
With a kid, once they're 12, 13, 14, the parent brings them, they can't drive. The parent brings them to the appointment, but at some point in the appointment, then they specifically talk to that child by him or herself. Right. And for all of these reasons, are you embarrassed to say things, is there anything that you need to tell me, that you can't say in front of your parent because your parent is the problem. But that's best practices already about how pediatricians are supposed to be treating young people, right? Is that there should be a separate conversation, a private conversation that's just with the young person and the doctor. And this is basically trying to just eradicate any of that. No doctor and no reasonable person, no person who's been a teenager, honestly, would not think that sort of separate conversation is not just helpful, but necessary in basically all situations. And whether we're talking about with y'all, which obviously are parents who their kids do trust, but for the many, many, many young people out there who don't benefit from that, who don't benefit from a parent who they trust or who isn't abusing them.
We need to also not put this on the doctor to where the doctor says, parent, you have to get out, because it makes the whole thing awkward. Then we know the parent is going to ask the kid, questions. If you don't trust them, what's the issue here? We need parents to have a certain level of emotional maturity and accept that in the end, you can't stop everything. And your kid may have different views and values than you, and you cannot, if you force your values and views on them, we know what's going to happen. And I think that, again, you don't have to agree with something. Something doesn't have to happen in your home, but making sure your kid goes to the doctor and has a space to even say something is not feeling right in a certain area. It's like there's so much taboo. And I think we know also with sex education, kids are waiting to have sex. So it's like, I just don't get it. I really don't.
So going back to the trying to legislate morality or trying to legislate good parental skills, which is not, that's not going to be effective. We can't legislate those things. But for lawmakers, they're always coming at it from the perspective that like most parents are doing X and most parents might be doing X, but we need to be legislating from a space that doesn't assume that, right? We need to be legislating from a space that the law is protecting people, protecting children that don't have a parent who they can trust, protecting children who don't have a legal guardian. We should never be making laws that are based on like a premise of like what we hope parents are doing, right? Because the parents that are protecting their kids, this law will never hurt them. This law will never affect them, right? We need the laws to protect children who don't have that.
People use what we're doing as an excuse to say why we shouldn't allow consent because, this needs to be done in the home. Even for myself and being in this field for a while, I still don't trust me to have a full-blown sex education conversation with my child because also I know how education works. They're going to listen to other people more. And why not their doctor?
Yeah,
why not let
that's
them have conversations?
I think that's the thing that upsets me the most kind of about this is that we're a law like this instills in young people at a very young age that they're not supposed to trust their the medical providers, licensed social worker at school or their pediatrician are not on their side, that they're not the primary concern of that medical professional. It's their parents. This attack on the trust between patients and providers is like a very, very, very strategic and decades long strategy.
I do wonder if they're okay if minors can pick up ivermectin over the counter. When you start to peel back the layers, it's about agendas for people who are against these types of things. And I do wonder, I bet they would be okay with that.
Yeah, no, I agree with all of these things. And I think it's just also important to remember that it's not just about instilling distrust in the patient-provider relationship, but really, honestly, these laws are about isolating children.
Yeah.
They're about isolating
100%.
them. Like that you don't even have the ability to go to someone outside of your parents.
Yeah.
All
right. Last thing that I'll say on this, because I wanted to say it earlier, but I couldn't get a word in edgewise between the two of you, is that going back to Katrina Jackson, I'm so concerned that a minor who's pregnant would be able to go and get prenatal care or even go into labor and delivery. The other thing that is an existing law is that even a minor can consent to the health care of their child. So we would be setting up a situation in which a 16-year-old who had a baby couldn't have consented to the health care required to have that baby. Once the baby is born, they could consent to their baby's health care, but
not their
still
own.
Could not consent to their own fucking health care. Like, I feel like I'm fucking taking crazy pills. It's insane. This bill got so bogged down in the absurdity of what they were trying to do that what happened, Morgan? Tell us what happened.
I think that, one, nobody knew what we were really talking about in the end. To be perfectly honest, even the people who were trying to help us were not helping us. They were confusing things. And again, not understanding the law. So ultimately, Senator McMath asked Rep. Chenevert if she would just pull it back and work on all the issues. So it was voluntarily deferred. It's coming back, it will come back. There is a consent statute where different people can consent to certain types of treatment. Again, I don't think anybody has ever thought they needed some sort of permission slip to send their parent to bring their child, meaning like a grandparent to bring their child to the doctor. I mean, really, again, too, consent is really about the legality of everything, not disclosure. They're confusing disclosure with consent. And I'm not saying that there aren't things that could be worked through. I have no doubt that there, you know, especially teens that get pregnant and are just so scared in that moment. They just really have a lot of fear. But it was being made to sound like even going and getting a pregnancy test was somehow something we needed people to consent
Parents
to.
needed to know. Parents needed to be able to consent. I mean,
do you think those
insane.
crisis pregnancy centers stop minors at the door, ask for ID, and say you need a parent to consent to a pregnancy test?
Absolutely
or an
not.
ultrasound?
It's not medical care,
Nope.
so you don't
They
need to
welcome
worry
that's
about
them
right.
in,
that.
and they sit them down and they, you know, talk to them about Jesus.
Well, just so to put a final point.
I want parental consent to be able to talk to my child about Jesus. That's what I want.
Yeah, no shit. Which, I mean, that also used to kind of be the laws. Yeah, no, I mean, the long and the short of it is that the bill was resoundingly rejected, in fact, because it's doing a lot of things and also doing nothing. And basically everybody has concerns about it. So I'm sure we'll see some version of this next year. But the point really is, at the end of the day, that like, what is the problem to be solved here? Like, no one has really actually pointed out what is going on now. That's a problem.
Right. And I think, like, going back to just state what you are very much not wanting kids to consent to, which I still think it would be weird to put vaccines because, again, they offer vaccines and encourage them when you are pregnant. But, you know, the gender affirming care, that's done. You can't even consent to it.
Maybe you need like an affidavit from the fetus saying that they consent to the vaccine when you're pregnant.
Probably.
All right. So before we wrap up, Morgan, I wanted to ask you if there were any other bills this session that you thought it was important for our listeners to know about.
I know y'all have talked about one bill. Everyone was calling it the chemtrails bill, with Kim as in chemistry, CHEM, but her name was Kim Coates, who was debating it. So that was funny. But in that debate, I think it was Rep. Walters asked a question. She said something along the lines of, is this the one dealing with planes dropping vaccines or something along those lines? And the answer to that was, no, that's not this bill, meaning this was part of some discussion somewhere where they're saying that airplanes are dropping vaccines everywhere. And nobody really talked about that because it was just, there was so much other crazy about this bill. But I was really taken aback by the response that, like, okay, well, we're not addressing that in this bill, but we're probably going to work on, like,
yeah.
Oh my gosh.
That's a total precursor.
Dropping vaccines? What is going on?
A harbinger. That's a harbinger of what's to come.
Oh my God.
Did y'all notice that or remember
No.
that? Go back and watch on the house.
I didn't watch any of that bullshit. I just saw it when Michelle played it for me, and that was enough for me.
I watched that little reel of clips probably 15 times. It's in my little folder of what I call happy place videos that I watch when I just really need to laugh.
I need that. Can you send that to me? Because I try to go back and find them, but I haven't.
It's a good one.
I do think we should be on the lookout for this vaccine dissemination by airplane. Because, you know, that would be like the most economical way for like
I can't say I would be
companies and the government to be.
It may be a good idea for people to vaccinate that way.
Well, once they get all the laws in place to make sure that people basically don't have to get vaccinated.
They don't even want us to have fucking fluoride in the water. You think, I mean.
Right.
God. Okay. So my little pleasant surprise of the session was that Representative Boyd introduced what's called an HCR. It's a House Concurrent Resolution. So all that this bill does is basically urge and request. It's like you're asking the state agency to kind of look into something, maybe do something. It's not like, it doesn't really have any teeth. It's
a request.
Yeah, it's a request. It's trying to get some more information. Like, hey,
Or
maybe
as
this is an issue, whatever.
Or as Rep. Cruz has called it, an urgent request.
Oh, really?
Oh, yes. That was last session. Not an urge and request. This is an urgent request.
God, okay.
Well, he does not know how to read.
Our listeners will soon be able to make their own judgment onto his intelligence
or ability to read.
When Representative Boyd introduced this in committee and also then on the House floor, to be clear, all this was trying to do, and Boyd explains it, is to just ask LDH to consider lowering the age for recommending people get mammograms because early detection is important. We have high rates of breast cancer and increasingly high rates of breast cancer among people younger than the age of 50, which is, I think, what the current recommendation is. So that is her HCR. I'm going to play the exchange between Representative Cruz and Representative Boyd on this very issue.
Representative Cruz.
Thank you, Mr. Chairman. I spoke with Representative Boyd in the anteroom about this. Unfortunately, I've come across information that says we're overdiagnosing this, so a lot of people are going through trauma they shouldn't have because they could have lived with this and died and never known they had it. They say between 5 and 50 people diagnosed with breast cancer that would have never known it and never would have died from it. So we basically turn between 5 and 50 women into cancer victims. There's a chance of the pressure of the mammogram rupturing the cyst or whatever. The research online says they rarely save lives. They do always cause harm, and they don't recommend them as a screening tool. I've got research from the Cochrane Institute that says they recommend that you only do that after a thorough consultation with a doctor and only for people over 50. So I'm just putting a different spin on it. I think sometimes when we think screening is a good idea, it turns out to be a bad idea. And this is the one case that I've read online that screening is not saving lives like we think it is. So I've got a mother, a wife, and a daughter. So they've all had to consider this. And this is the kind of stuff they've come up with, talks with others, and my research as well.
Just remember, it's just an HCR, but are you saying that there's no studies?
I just want the LDH
saying
to
that
think
there's
about
no
that.
studies that say mammogram screening save lives?
I'm saying there's studies that say they cost lives.
Okay.
HCR 44 is simply requesting LDH to lower the age for mammogram testing to 30.
Members, while I think this is a noble effort here on this resolution, I do think in the light of the last couple of years where we had a real problem with informed consent, that it's important that women are made aware of other alternatives and they research a little on their own and their doctor informs them.
I don't want to dilute this because Rep. Cruz thinks that mammograms are harmful to you.
Members, I would, if I had a chance, to point you to something called the Cochrane Review. And in this study of several different studies of mammography, they come to the conclusion that overdiagnosis is a big threat.
So it's your understanding that we conduct too many mammograms right now?
I'm saying a lot of people are contending that there's a lot of radiation, and if you do this successive years, that builds up over time. I think we need to make sure our women understand all the pros and cons.
Do you think that mammograms are a necessary tool for doctors and women to detect breast cancer and prevent?
I don't know that.
Okay, so is your amendment to discredit mammograms? Is that kind of the way you're approaching this?
It's to make sure people are informed of other alternatives.
Rep. Cruz, do you know the price difference between a mammogram and an MRI?
I don't, but that's something they can discuss with the doctor.
Do you also know that the insurance will not approve an MRI over a mammogram?
That's possible.
Do you know how many lives mammograms save on an annual basis for women?
I read in a study right here, they say it's 1 per every 2,000.
Can you tell me where was the study conducted and how many people was in the study?
You can go online and find that.
Rep. Cruz, you mentioned that this comes from the Cochrane Institute.
The Cochrane Review, yes.
Do you know that the Cochrane Institute only evaluates studies? They do not do research. Do you know how many studies they review? Is it 1? Is it 2? Is it 10, 20?
I do not know, but I know
You don't
several
know.
people in this profession believe just the way I'm discussing this review to you.
Do you know that mammograms actually do save lives?
So this started last year. there's like a precursor to this that was a whole fucking thing on the floor with Cruz, and I don't remember it all exactly. There was research that came out that screening tool is maybe not the only thing that we should be using, like basically something like that like mammograms in and of themselves like maybe are not detecting cancer enough. This was like right before Cruz went on his spin last year. So then his spin was basically like, we shouldn't be doing them because like the research has shown that like mammograms might not be as effective at detecting breast cancer as previously thought. Do you guys remember this? You know what I'm talking about?
No, I don't, but I'm going to go look at.
Yeah, well, that's he's citing like the genesis of what he's saying comes out of some real medical research that he has like taken, of course, and like turned on its head. Like 100% turned on its head, that like maybe we need to be screening people, you know, in different ways or doing something else, like that mammograms might not be effective enough. And then last year it was then like, so we shouldn't be doing it. So people shouldn't be getting mammograms because like the research has shown that like they might not be as effective as you previously thought, which is of course no one would say that. Like it's still the most effective tool that we know of. We clearly need to invest more research in like coming up with other effective tools. Like no one who has any sense would be like, well, then we shouldn't be doing mammograms. And now this is like the like more insane version this year.
This was just the vehicle for his crazy. And he also, I think he like legitimately hates Representative Boyd with like the passion of a thousand suns. I have 2 points on this, but Morgan, I want to hear if you have any reactions.
Well, I didn't realize this because I just also didn't look it up, but Representative Davis made a point on the debate in the House floor that whatever he was citing was not actual research, but like a review, the Cochrane review of research on this issue. And again, just, you know, his comments about, well, people could have died from this and not known. And like what is he talking about?
Yeah.
Like, I just, they're making them cancer victims. It's again, like, you might be a little pregnant, right? Like you know, you either have cancer or not, but like, why wouldn't you want to know? I don't know where he was going with that. Not quite honestly, like it again, it just goes back into these issues where what is it? It's like, you can't help but think he wants us to die. Like, I mean, like that's the only way I see it. Like, why wouldn't you want,
he's also the only person, as you guys will remember, who has like voted against and or also like spoken out against HCRs that were about providing more food in on university campuses for students who, like athletes have said that they are basically starving, and also for just like HCRs on sickle cell anemia. I mean, like he is the person who has
he thinks
the only person who's voted against HCRs on that were widely supported by research and every other colleague. Yeah.
Well, because Representative Cruz is a complete jackass. I mean, he just really is, and I'm not gonna be gentle about that. He's a complete jackass. I will also note that he represents the House district that was previously occupied by our Speaker of the House in Congress, Representative Moses Mike Johnson. So the 2 points that I wanted to make are, one, his wife and mother, I guess he references here,
and his daughter, who apparently,
you know,
presumably is like very young.
You know, like they're having to look at this because I'm Googling some shit. I found some shit on the internet, and so now I'm advising them not to get their fucking mammograms. Like,
run. Women, like, fucking run. Like, run, don't walk. I will literally, like, tell you the nearest shelter in fucking Shreveport that you can go to. You have to get out of there. That's the first point. And then the second point is Representative Dustin Miller, who he's a nurse. Like, he is a medical professional.
And also a very moderate.
Very
like
moderate.
He's not a flamethrower, not a at all.
I love that he was like, okay, well, this is just an HCR. Like, why are you objecting to this? We just green light HCRs. Like, you know, no one, why are you concerned about this?
Which, to that point, the sickle cell anemia and the one to give kids on college campuses food were also HCR.
The sickle cell anemia one, I think it was because it was a DEI initiative.
Oh, that's right.
Or that's how he saw it. You know, that's
100% right.
Discriminatory because it was only
there is
only going to help Black people.
There is a through line here, because it's about, like, when he's saying here about it's going to make people into victims who are not really victims. It was the same thing with the food for college athletes, that, like, it's making people, like, feel and, like, identify with being victimized when they're really not. Like, that is his Republican through line here, is that anytime we're just trying to protect specific people, that's really victimizing them and making them, you know, act and feel like victims. And so that then discriminates against, he said this, that then discriminates against people not in that category. Like people who don't need food in college, like people who don't need to be screened for sickle cell anemia. Those people are being discriminated against, and the other people are being, victimized. I mean, it's just, you can't make this shit up, but that is what he's saying, because he can't read.
In 2022, Star had, like, interns that basically went around the Capitol asking legislators and different people to do Start by Believing post and you know, to fill out our little card. Start by Believing is, you know, what would you do if somebody you knew came up to you and disclosed that they were sexually assaulted? Every legislator you could think of, like, took a picture. My interns came up to me afterwards. They're like, Representative Cruz said he couldn't do it because he couldn't start by believing. I was like, what do you mean? And they're like, we asked him and he said, if it were my daughter, I mean, I couldn't just start by believing. I would have to ask questions. I would have to make sure she wasn't lying. And I was just like,
oh my God, he's
his own daughter,
so fucking bad.
So to Michelle's point,
yeah, he's
the women in his life, get out. There are domestic violence shelters.
Fucking run! I'm telling you, he's number one on my list of, like, the worst. He is one of the worst.
Yeah, well, and I mean, he says insane things out loud, which I do appreciate, honestly, because it does sort of, like, out all of this. Because, like, I mean, you know, I'm a lawyer. I defend people who are accused in school situations, as Morgan knows, but, you know, of sexual misconduct. But that your example would be if my daughter came to me. Like, I mean, that's so fucked up. It's just, like, it's kind of hard to believe. I can't start by believing with him saying that. That's just
it's like,
very hard to believe.
Usually when people change their views on something, it's because of they have empathy, the ability to empathize, and they have empathy because it's finally a family member. I can see it. You could.
He's just such a goddamn idiot. He's just such a goddamn idiot. I mean, that just is really, because, like, again, like, the, you know, when we're talking about due process, then, you know, decision makers do need to ask questions. They do need to ask questions.
And that's
when it's your child who tells you that this happened to them, you don't really need to ask a lot of questions.
The first thing you should ask is, are you okay?
Well, for sure. No, I mean, for sure.
Again, and, like,
his question would be, what were you wearing, you little slut?
Exactly. I mean, like,
were you drinking?
Oh my God. Oh my God.
Yeah. Is this the night that you stayed out past curfew?
And this is why we need minors who can go get tested and get treatment for STIs, because, again, people like this.
So he goes on to introduce, so the bill no thanks to him, does actually get out of committee. And then again, HCR goes to the House floor and he tries to amend it. No one, I don't even know. I mean, somebody hopefully can look this up. I don't know that anybody's like how many times people have actually tried to amend an HCR on the House floor that wasn't the bill author, that was like
Or technical.
Right, exactly. So he tries to amend it, and there's some really good back and forth. Again, Representative Dustin Miller brings up, because one of Cruz's things is like, he's like, well, maybe the mammogram isn't like the best screening tool, like MRIs or other kinds of scans might be better. So then Representative Miller's like, yeah, okay, but insurance isn't going to cover that. Do you like, I mean,
which
that's
again,
ridiculous.
that goes back to like that, like there's a kernel. This is why he's just a fucking idiot. Is that there's a kernel of medical truth to like what his issue is here, but like he's like just extrapolating that out in like the least useful, most illogical way. That like yeah, there has been some research that mammograms are not as good at screening breast cancer as we previously thought. So the answer to that is not that people shouldn't get mammograms. The answer is we need to do like more research and get insurance coverage for other screening, not just like, well, then clearly we just like, we should give up on this and tell women not to do it. And I mean, yeah.
The last thing that I'll say about Cruz, and then we can wrap up. But the last thing that I'll say about him is he is a pilot for, I believe, American Airlines.
Oh, is it American?
No, it's jankier.
It's a major one.
I hope it's not Delta. I have a lot of Delta Sky miles. I want to still be able to fly Delta.
Anyway, he is a pilot. So just know that, people, that he's in charge of your safety on an aircraft, and that is a little terrifying to me. And he's a complete jackass.
Jackass who doesn't care about people and also thinks that safety is things like, if the research shows that maybe this isn't the always effective tool, that we should just stop doing it.
Yeah.
Like, what's the pilot equivalent? Like, you just just stop the safety then. Like, not all plane crashes have been prevented by the safety mechanisms they have in place. So I guess they should just stop doing them.
Yeah. I will also note that he did have a bill this session to abolish the TSA. And
Delta. It's Delta.
And Delta. Okay. All right. So anyway, just tag Delta. Okay.
Why does he want to like carry like a bunch of abortifacients on planes? What's going on? Why do we need to abolish TSA? Is he transporting guns, minors, and abortifacients across state lines?
Honestly, when he presented that proposal, I was like, I kind of agree with him a little bit on some of this. Like, we have gone too far since 9/11. And as I mentioned earlier, I didn't get a chance to talk about this one with Ellie, but the debate over House Bill 429 by Representative Boyd was crazy and gross. So this bill would have prohibited workplace discrimination based on sexual orientation or gender identity. So there are currently no protections for LGBTQ plus individuals in the workplace under Louisiana law. And you all might remember that Representative Boyd talked about this issue with us. So I want to play some of the committee hearing for this bill.
My name is Ken Ayub. I am the board chair for Forum for Equality, Louisiana's statewide LGBTQ plus human rights organization. HB 429 would prohibit workplace discrimination based on sexual orientation and gender identity, something that should already be on the books in every corner of this country. The fact that LGBTQ plus people in Louisiana can still be fired, demoted, or denied a job solely because of who they are, it's a disgrace. 29% of trans people do live in poverty, and that is a direct result of not having job security. LGBTQ plus people work in every sector of our economy. We're teachers, we're nurses, we're engineers, first responders, public servants. We show up every day and do our job like anyone else. We deserve the same protections everyone else enjoys.
So this committee, the Labor Committee in the House of Representatives, is chaired by Representative Cruz, who y'all know I just adore. He's so smart. He's so compassionate, whatever. But we also are going to get the pleasure of hearing from Representative Wilder, who truly would not shut the fuck up. So let's listen to the esteemed Representative Wilder.
I mean, I think the whole body is aware of the fact that last year we passed a substantial bill that specifically states that gender identity and other subjective terms shall not apply with respect to what we're talking about in the state of Louisiana. And that bill passed heavily in the House and was signed. So I'm just trying to figure out. I mean, I don't understand it, but I guess it answers most of my questions. Thank you.
You're welcome.
So, I guess the other question is or another question. So the bill I was referencing last year that passed, the Women's Safety and Protection Act, applies to public spaces. It doesn't regulate what Target can do. It doesn't regulate with any private business. Mm-hmm. This seems to be regulating everybody, including private businesses who are, am I correct there?
No, it does not. It does not direct anyone. So,
is it specific to just state, or is it apply to any business, such as a privately held fast food restaurant or a startup guy who started a welding company? This applies to everybody?
It's a great question. It applies to everyone, just as race, religion. It allows you to be your full self. This adds sexual orientation, gender identity to the existing employment non-discrimination items that we already have on the books.
Yeah, this would apply to everybody. Why would you allow discrimination in some employment and not others? That just doesn't even make any sense to me.
And I'm trying to be compassionate here, but I mean, if you have a business that's a childcare facility and somebody walks up with 75 face piercings, that's fine, but doesn't the operator have the right to decide if, that may affect the kids that they're going to be watching? I mean, there's my business, when I first opened it 22 years ago, the policy of the company, not mine, the franchisor, was we couldn't have any visible tattoos. And it was based on, each market is different to what the guest base wants. I believe this could put a burden on businesses that doesn't allow them, and forget the specifics of the, I think it puts an undue burden on private employers. And I don't think that's fair. I think that, if we start to encroach on free enterprise and free markets, I think we're getting into a bad space. So I just wanted to clarify that specific part of it.
Race, religion, sexual orientation, gender identity are not things that you can control yourself. I can control not going and get a tattoo.
I mean, I think we disagree on the objectivity of gender identity with respect to not being able to choose. Maybe that's where we disagree on this, and I'm fine with that, but okay, fine. Thank you, ma'am.
When you look at this bill, it does allow people to bring their entire selves to work. And the data does show, if you're able to bring your entire self to work, you're able to be more productive. If you're more productive, you're able to give your employer actually more profitability in their business. This bill simply, as Rep. Boyd said, it opens the gates up to allow someone to be them full selves at work. That is all we're asking. This bill does not introduce any special privileges whatsoever. It just protects people in the same way you want to be protected when you're at work.
Just one question. Would you not agree that the things you're looking to identify or single out here are more behavioral than they are, a characteristic of a person? These seem like more behavioral identities, not actual deeply held beliefs or anything like that.
If you're in an office today and you might have a picture of you and your wife on your desk, I want to be able to put a picture of me and my partner on my desk and not fear that my employer can then fire me for that because they just don't like it.
Representative Wilder, are you ready to ask your question?
I think what frustrates me is the presumption of being discriminatory simply because we don't agree on the fact that gender identity is a subjective term or not. There's also personal religious rights and religious liberties in our country that people fought for hundreds of years as well and have died for. And I think this crosses that line. Not to make humor of this because I'm being totally serious, but I've had schools and in my area that was in a facility that was the focus of part of why I ran that bill, in addition to just thinking it was the right thing to do. But when you consider the subjectivity of a personal decision, we can debate whether or not that's a decision or a biological. We can debate that. I know where my beliefs are, but is the next bill going to be about furries? And now that every company has to put a litter box in the corner, I'm being sincere on that. Where's the line on some absolutes.
We were fighting to even have African Americans considered equal. People said things like, what's next, monkeys? So I think the terminology of saying furries is insane.
Oh, give me a break.
You give me a break.
My own company, the majority of my team is not Caucasian. The majority, a hard majority. So to sit here and throw racial epithets at me is just not acceptable. The majority of my management staff is not Caucasian. I think that says enough. I want to talk about something. I wanted to drive for Amtrak when I was 18. You know why I didn't get the job? Because I was a white male. So give me a break, with all due respect.
I mean, Representative Wilder is just out of fucking control. I mean, his examples are so offensive and so ignorant. It's fucking unbelievable. I mean, it really actually is unbelievable that this is somebody that, at least a couple hundred people voted to send to the state legislature to represent them. And I really, really, really appreciated Representative Boyd pushing back on his statement and bringing it back around to what some of the opposition was to passing anti-discrimination laws to protect people in workplaces that are Black or different races. Obviously she's speaking from true historical context, and then him getting so offended by that, it's well, the lady doth protest too much. Also, what the fuck? He's like, I have Black friends, so I'm obviously not a racist. Just stop. Let's listen to Representative Boyd wrap up the closing on this bill and lay out the reason that she was trying to get this done.
My intent of this bill was really just to open up the avenues where qualified people can earn an income, be productive citizens, add to our economy, maybe close the gaps with some of these shortages that we have across our state.
And I mean, this is the third or fourth year that she has brought this bill. And back when we talked to her earlier in the season, we played some of former Representative Woody Jenkins and his despicable comments. And, here we are 2-3 years later. And this is what the people that are on this committee are saying about. I mean, it's really frustrating. So needless to say, this bill did not get voted out of committee. And, we hope that Representative Boyd, and if not her, somebody else will bring this back, because again, we need to just keep pushing this forward. But it is very, very, very frustrating when we're confronted by people on the committee that are just so absurdly ignorant and think that their religious freedom ought to protect them from just being a bigoted douchebag. Anyway, that wasn't a very uplifting little thing to add into this episode, but it is important, and it was something that we didn't talk about earlier in the season or during the legislative session. So I wanted to throw it in so that you all know. So folks in Representative Wilder's district, this is what he thinks about the LGBTQ plus community, and, the more you know. So that is going to do it for this bonus episode, and we are still on break, but we will be back in August with new episodes. So we will talk to y'all then. Seriously is presented by Lift Louisiana, a nonprofit organization advocating for reproductive health rights and justice.